Hi, I'm Becky. I'm a BABCP accredited cognitive behavioural psychotherapist. How can cognitive behavioural therapy be specifically adapted to address the unique challenges faced by people with both ADHD and binge eating disorder? Cognitive behavioural therapy, or CBT, is a highly effective treatment for binge eating disorder and can be adapted. A specific type of CBT called CBTE for eating disorders should be highly individualised for the client and adapted as needed for ADHD. Ideally by a therapist or clinician with further neurodiversity training and/or lived experience. CBTE normally takes 20 to 40 sessions in eating disorder services, and of course, working privately gives space to allow more sessions if required. CBTT is a shorter, more manualised version of CBTE and comprises of 10 sessions, hence the T, which stands for 10, and then 2 follow-up sessions. Some clients thrive on a highly structured, rigid therapy like this, but from my clinical experience, I found this can be hard to utilise well if a client has a complex trauma or ADHD background. Other more generalised CBT approaches can be helpful too, which I'll describe shortly. Adaptations in communication, in therapy sessions, and using technology to foster hyperfocus and other ADHD traits can be helpful. I asked the client what would be helpful for them when we set out the session agenda, whether they prefer a more structured CBT approach or whether they prefer a more tangential or relational approach where we allow things to arise. I usually find a combination of these approaches works well from the feedback I've had. Within eating disorders themselves, impulsivity, emotional dysregulation, and difficulty with executive functioning are the key aspects to look for when adapting CBT for this client group. People with ADHD often struggle with impulsivity and may engage in binge eating episodes without considering the long-term consequences, such as physical health or emotional distress. Integrating mindfulness practices to increase awareness of triggers, cravings, and the emotional states leading to binge episodes. These can help the person pause before acting impulsively, using strategies like stimulus control, where environments or cues that trigger binge eating are identified and modified, such as removing tempting foods from easy access, can be helpful. Looking at impulsivity management can involve setting up pause points in therapy, where the individual practices pausing before acting on impulses. For example, counting to 10 or using a breathing technique before eating. The use of urge surfing is another example of this, but doesn't suit everyone either. It's about applying a nuanced, inclusive, adaptive approach to helping improve impulsivity. Both ADHD and binge eating often involve emotional dysregulation, where strong emotions such as stress, anxiety, sadness, guilt, and shame trigger binge eating episodes. Incorporating exercises to help individuals recognise and name emotions. This awareness helps to avoid using food as a way to self-soothe. This would also be good for those individuals with alexithymia who may struggle to recognise and name their emotions. Good ways of doing this are incorporating thought diaries and journaling with guided prompts to promote adherence. Just asking an individual with ADHD to meditate, breathe, or journal isn't that helpful. However, having a structure to these activities and being motivated by choosing their own prompts or guided exercises can increase motivation and empowerment to recovery. In CBT, a technique called cognitive restructuring can teach clients to challenge distorted thoughts that drive emotional eating, such as, "I've had a bad day, so I deserve to binge," and replacing them with more balanced thinking patterns such as, "I've had a bad day, so I deserve to treat myself with kindness and self-care. Instead of binging, I can choose something that really supports my well-being, like resting, talking to a friend, or doing a different activity that soothes me." Identifying and challenging negative self-talk is important for change. Another example is when thinking, "I always fail at controlling my eating," reframe this to a more realistic thought like, "I can make progress, and I have learned from past challenges." ADHD often involves difficulties with organisation, planning, and maintaining focus, which can lead to inconsistent eating habits and difficulty sticking to recovery plans. Breaking down large goals, i.e. stopping binge eating into small, manageable steps is much more helpful, and being less rigid with the goals, such as reducing the binging or knowing a binary goal, can sometimes set up for failure if not achieved within a certain time. Use visual aids like planners, checklists, or apps to track progress, but also not be too hung up on rigid, perfectionistic type goals. Work on creating structured eating schedules and meal plans, as individuals with ADHD may forget to eat or struggle to make healthy food choices without a set routine. For complex situations, such as preparing meals or handling stress, breaking tasks into smaller, more manageable chunks helps to reduce the overwhelm. People with both ADHD and binge eating disorder may have a high degree of self-criticism and low self-esteem, often stemming from past struggles with control and weight. Many ADHDers have something called a schema, which is used in schema therapy, where they have unrelenting standards of themselves, which are harsh, controlling, punishing rules with high expectations and perfectionism. The antidote to this is compassion and adaptive flexibility. Training an individual in self-compassion takes time, and it's like a muscle, it needs repetition, but it's well worth it. Treating oneself with understanding rather than harsh criticism, particularly when lapses occur in eating habits, is key to recovery success. Encouraging and motivating by rewarding small successes, such as a day without binge eating, but also other non-food related goals, helps to foster motivation and is a positive reinforcement. Hi, I'm Becky Grace Irwing. I'm a BABCP accredited CBT and EMDR qualified therapist and qualified mental health nurse. You can find me on Instagram at Becky Grace Therapy or at Becky Grace Irwing on LinkedIn. If you'd like to learn more about my practice, check out my website, beckygracetherapy.co.uk. I've just spent the day filming with Mindfriend. Stay tuned for all our upcoming content.